Bismillah ar-Rahman ar-Rahim. The title of our lecture is Tumor Immunology, Tumor Antigen Treatment and Evasion. The tumor, the definition of the tumor is the pathological cell masses derived by transformation of normal cell to malignant cells by abnormal and uncontrolled clonal expansion of single cell. This is occurred due to spontaneous mutation during daily cell division, and it may be induced by physical, chemical, carcinogen, or viruses. Tumor immunology, the two scientists, Bernard and Thomas Ideal, was the immune system continually surveyed the body for the presence of abnormal cells, which are destroyed when recognized, and the immune response to tumor was an early event leading to destruction of tumor cells before they become clinically apparent. And this is known as immune surveillance. So any abnormal cell, the immune system recognized it and removed by the macrophage from the circulation. And if this abnormal cell failed to remove, so this leads to tumor induction. The tumor had antigens on its cell surface, and these antigens are divided into two types. First, tumor-specific transplantation antigen, this is the abbreviation T. Tumor is specific and T for transplantation antigen, and this is from its name, it's unique to the tumor cells only and do not present on the normal cells. And these antigens are present due to mutation, which is induced by physical, chemical, carcinogens, or due to viral infection. The another type of the antigen, tumor antigen, is the tumor-associated transplantation antigens, which means that these antigens are present on both tumor cells and normal fetal cells during the fetal development. And these are the alpha-fetoprotein that increase in hepatocellular carcinoma and carcinoembryonic antigens that increase in colorectal cancer. And these antigens are known as tumor markers, which indicate the presence of the tumor in the person. And the another type of that antigen is overexpression of protein on tumor cells like epidermal growth factor, and normally expressed at low level on normal cells. So we have two types of the tumor antigens, tumor-specific and tumor non-specific, that's presence on the tumor and normal cells. Now we have tumor markers. What's tumor markers? From its name, that these markers indicate the presence of the tumor, and either tumor antigens or tumor products like enzymes and hormones. The tumor products like antigen, enzyme, hormones are released in the serum of the patients, and they are used to confirm diagnosis and follow up the response to therapy. Tumor antigens, which is alpha-fetoprotein antigens in case of hepatoma, carcinoembryonic antigen in case of GI tumor and tumor of biliary system, and cancer antigen 125 in ovarian cancer, and cancer antigen 15.3 in breast cancer, cancer antigen 19.9 in colon and pancreatic tumor, and prostatic specific antigen and prostate CA of the prostate. Second, tumor products, which include hormones or enzymes. Hormones like human chorionic gonadotropin are secreted in case of choriocarcinoma, thyroxine in case of the thyroid gland, and the second type, the enzymes like acid phosphatase in case of CA prostate, and the alkaline phosphatase, lipase, amylase in case of CA pancreas. How can tumor induce? The cancer induction. Normally, tumor cell develop from normally we have normal cells, and the tumor will develop from this normal cell. Each individual possesses genes responsible for the cancer formation, which is called oncogenes. And these genes are dormant, and because they are under the influence of the another genes, which is called tumor suppressor genes. When there is chemical, physical, viral, and psychological factors which is lead to induce or inactivate these tumor suppressor genes. So we have oncogenes and tumor suppressor genes. And the chemical factor, physical, viral, psychological factor lead to inactivate of these tumor suppressor genes. And this tumor have many stages: stage 1, stage 2, stage 3, and stage 4. For example, in CA colon. So the immune response to tumor. First, the innate immunity, which is the first line of the defense mechanism, which is including neutrophils and macrophage through the H2O2, nitrous oxide, tumor necrosis factor, interferon, and the hydrolytic enzyme. And NK cells through the ADCC, perforin, and the granzyme. This is the mechanism of action to kill the tumor cell. And if the innate immunity fails, so the second line of the defense mechanism is the adaptive immunity, which is included humoral immunity, which is activation of T cells and antibody formation, and the cell-mediated immunity, which is T cytotoxic and the CD8 T cytotoxic. And this leads to production of the cytokines like interleukin-2, interferon, and macrophage activating factor. So the cellular immunity, T cell, which is responsible for the TB, tumor transplantation, except hyperacute rejection, and the viral. So all of them with T as a rule, except and unfortunately the viral start with V instead of T. Tumor evasion or evade mechanisms of the tumor: antigen modulation. The tumor cell changes its outer surface of the antigen masking that cover its own antigen, seeking through tolerance, reduction of MHC class 1, lack of costimulatory signal, B7CD28, which is the second signal in the T cell activation, and blocking antibodies that the tumor cell induce the production of blocking antibodies. And the last one, expression of B7H1 helps the tumor cell evade the anti-tumor immunity. And this is the checkpoint in the immune system. Treatment of the cancer: first, by the surgical removal of the tumor. Second, chemotherapy, radiotherapy, effective, but it does not prevent tumor recurrence besides its serious side effect. So the immunotherapy, which is the main subject of this lecture, which is using the body to fight the cancer and to eliminate any tumor cell that evade the surgeon knife, like removal of weeds from the farm. So immunotherapy: stimulation of active host immune response to tumor cells that evade the surgeon knife, and chemotherapy and radiotherapy. Immunotherapy is a broad category of cancer therapies that use the body immune system to fight cancer cells. Think of these rapidly dividing cells like an out-of-control copy machine that won't stop creating images. These abnormal cells frequently change or mutate to evade the immune system, and immunotherapy drugs are designed to alert the immune system about these mutated cells so it can locate and destroy them. And this immunotherapy can be achieved by vaccination, which is either used to kill the tumor cells or used to purify the tumor antigen as a vaccine. And another type using the dendritic cells, the activation of dendritic cells, which is necessary for initiation of primary and secondary immune response, and this can be induced by the endogenous danger signals released by tissue undergoing damage or abnormal death, and some endogenous danger signals are heat shock proteins, nucleotides, reactive oxygen intermediates, extracellular matrix breakdown, and cytokines like the interferons. The second type, exogenous danger signals elaborated by the pathogens. So here the danger signals, either exogenous, which is non-cell, and endogenous, which is the primary endogenous and secondary endogenous. And the dendritic cell vaccine by using dendritic cells pulse with tumor antigen, and this is the dendritic cells, and induced or transfected with tumor antigen, and then this dendritic cells will express the tumor antigen on its cell surface, lead to activation of the T cell, or the dendritic cells transfected with the plasmid expressing the tumor antigen, and here the plasmid, and the transfected with genes that coded the tumor antigen. So this dendritic cells will be expressed the its cell surface tumor antigen association with MHC, and this lead to stimulation of the T cell. The another type of the immune therapy to tumor is using biological response modifiers like cytokines, tumor necrosis factor, interferon, BCG vaccine, which is used in the treatment of CI bladder, dendritic cells or T cytotoxic cell transfected with cytokine genes, and also the magic bullet, which is the monoclonal antibodies directed against tumor antigens coupled with diphtheria toxin or cytotoxic drug. And this is called the magic bullet because it's only directed to tumor cell and not attack any other cell. The another type, clone cytotoxic T cell, specific for human tumor antigens. And another one, lymphocyte activation killer cell, LAC,